আমার নাম সঞ্চয়িতা ঘোষ, চিন্ময়ী ঘোষ, ৭৬ বছর বয়সে। উনি আমার শাশুড়ি হন। তা উনি লাস্ট ১ মাস ধরে একদম বিছানায় শয্যাশায়ী, বসতেও পারেন না এবং চলতে পারলে খুব অল্প অল্প চলতে পারতেন। তো সেই অবস্থায় আমরা আর.এন. টেগোরের ডক্টর সুজয় কুমার সান্যালের একটা রিলেটিভের থ্রু দিয়ে এরকমই একটা কেস উনি আগে সলভ করেছিলেন আমাদের ফ্যামিলির, যিনিও খুবই হোপলেস কেস ছিল। তার থ্রু জানতে পেরে আমরা ওনার কাছে অপারেশন করাই। লাস্ট ১০ দিন হলো অপারেশন হয়েছে। অপারেশন 12 আওয়ার্স লং ছিল এবং অপারেশন ভালো সাকসেসফুল হয়েছে। পেশেন্ট খুব তাড়াতাড়ি রিকভারি করছে, এর মধ্যেই ওয়াকানে হাঁটছেন এবং আমরা এর আগে হসপিটাল নিয়ে আসতে হয়েছে পুরো অ্যাম্বুলেন্স ভাড়া করে, একদম লাইং ডাউন সিচুয়েশনে। সেখান থেকে এখন ফিরে যাচ্ছেন হুইল চেয়ারে করে এবং ওয়াকারে হাঁটতে হাঁটতে। আশা করি এরপরে আরও রিকভারি ফাস্টই হবে। তো থ্যাঙ্কস টু ডক্টর সুজয় কুমার সান্যাল, উনি এত বড় একটা রিস্ক নিয়ে এরকম একটা এজেড পার্সনের এত ভালো একটা সাকসেসফুল অপারেশন করার জন্য।
Hello, I'm Dr. Sujoy Sanyal. I'm Senior Consultant Neurosurgeon, Spine Surgeon at the Rabindranath Tagore Hospital, Calcutta, India. So today we are talking about this very elderly patient who came to me around 2-3 weeks back. She came to me on a stretcher. She was completely bedridden for 1 month with severe back pain going to the radiating down to both the legs. And her son had come down from Singapore along with her daughter-in-law, and they brought her to me on a stretcher. She was in excruciating pain, unable to get up, unable to walk. As I said, excruciating back pain radiating to both legs. Basically, they had got my reference from one of their relatives. One of their relatives was also an elderly lady who had been operated by me had undergone a spine surgery. And she had also come to me in a bedridden condition, and she has recovered completely and she is walking. And so that's how they got my reference, and that's how they came to me. So we got when this lady came to me, we got a MRI, CT scan, etc. done, which revealed that that she had spondylolisthesis, which means that one vertebral body had slipped over another vertebral body. There was severe pressure on nerves coming out from the spine. So the nerves supplying the legs were severely compressed in the lumbar spine at multiple levels. And in addition, there was severe osteoporosis, like the bones were really soft. So I discussed with the family at length, that this was going to be difficult surgery, because of old age, as well as severe osteoporosis, as well as multiple level spinal compression. I told them that I only do minimal access spine surgery. I do not do, I have not been doing a traditional open spine surgery for the last 14 years. I only do minimal access spine surgery, which means I operate on the spine only through small holes. So that anyway makes the surgery a little more expensive. Plus, there was severe osteoporosis, so we had to incorporate other technical things which would make the surgery more expensive as well as long. However, what I must commend about this family, that they plucked up the courage to go ahead with with a relatively expensive surgery and time-taking surgery for such an elderly woman. They plucked up the courage, and I am sure that they were able to pluck up the courage because they already knew about one of their relatives who had undergone a spine surgery and who had recovered from a completely bedridden condition. Now, so we went ahead and did this surgery, and as I said, that the spine was severely osteoporotic. So we put screws in the spine, and so that the screws would not slip out, we injected bone cement through the screws into the bones so that the screws will not slip out, and the screws are jammed in place. We took away all the pressure from the nerves which come out from the lumbar spine, and then we reduced the spondylolisthesis, which means that we realigned all the vertebral bodies, and we fixed the lumbar spine fix the screws with rods. Now, as I said, we do this surgery only through small holes. Like this kind of surgery which she had undergone, if she had undergone by a traditional method, it would require a really long incision and extensive muscle retraction. However, as I said, in her case, we did it through 2 small holes. The maximum length of one hole was 5 centimeter. That too because this was a multi-level spine surgery. Now, I am very happy that she's made a stupendous recovery, from a bedridden condition, from excruciating pain. Today, she is independently ambulatory with the help of her walker. She just needs to be under supervision. And I'm sure that, given time, it's just 10 days since surgery, and given time, she's going to recover, and maybe she might be able to even get rid of a walker. So this in my, I've been doing minimal access spine surgery or minimally invasive spine surgery for, almost since 2007. In my experience, so I have operated on lots of lumbar spines. Now, in my experience, this was one of the most difficult lumbar spines I had operated on, and especially because she was elderly, multiple level compression and severe osteoporosis. This was one of the most difficult cases I have operated on, and I'm really happy that she has made such a stupendous recovery from a completely bedridden condition to becoming independently ambulatory with the help of a walker. Thank you so much.